नमस्कार। 4 दिन पहले यानी 8 जून को वर्ल्ड ट्यूमर डे के रूप में मनाया गया और उस दिन दुनिया भर में कार्यक्रम आयोजित किए गए। इसका मकसद था लोगों को इस खतरनाक बीमारी के प्रति जागरूक करना। आज हमने यही बीड़ा उठाया है अपने लोकप्रिय ऑनलाइन शो हेल्थ फॉर ऑल के माध्यम से। मामूली सिरदर्द से शुरू इस जानलेवा बीमारी के बारे में लोग बहुत कम जानते हैं, इसलिए उनकी अज्ञानता इस मर्ज को और बढ़ा देती है। लोगों को स्थिति की जानकारी तब मिलती है जब काफी देर हो चुकी होती है। आज हमने देश के जाने माने न्यूरोलॉजिस्ट और न्यूरोसर्जन्स को अपने शो में आमंत्रित किया है, जो हमारे और आपके मन में उठने वाले हर सवालों के जवाब देंगे। क्यों होता है ब्रेन ट्यूमर, क्या लक्षण हैं इसके, और सबसे बड़ा सवाल कि क्या इससे बचा जा सकता है, यानी इसका प्रिवेंशन है कोई, और अगर किसी को ब्रेन ट्यूमर हो गया तो क्या कंप्लीट क्योर संभव है। ऐसे सभी सवालों के जवाब आज हम डॉक्टरों के माध्यम से आप तक पहुंचाएंगे।
We commence the first session on yoga for mental health.
These days, the most common issue that most of us face in this fast-paced life is stress. And as we all know, stress is the root cause for most of the health issues that we all face these days, like diabetes, like hypertension, and many hormonal or lifestyle disorders that we all go through. And I think not just the physical or the physiological issues of stress also affects the mind in different things like depression, anxiety. That stress is the root cause for it. अगर life में कुछ गड़बड़ हो जाता है तो we all get stressed about it, and if we don't know how to deal with the stress, and if we are stressed for a prolonged period of time, that results in anxiety, depression, and having anxiety and depression for a longer period of time results in many other clinical mental health disorders. So today's practice will be focusing on calming the mind. So we work first with asanas and pranayama, and if possible a bit of a short meditation if time permits. So let's look at it that way. The focus of today's practice would be to calm the nervous system, as well as lengthening the breath. Okay, so that helps in reducing the effects of stress. We'll start with a nice restorative posture. Sit either with your knees together or knees apart, all right, whichever feels comfortable for you today. And slowly bend forward, drop your forehead down. Shashankasana or child's pose. You can stay in this posture for about 3 to 5 minutes. This is a wonderful posture to regulate your breath. This is an amazing posture to regulate the nervous system. Remember not to tighten your shoulder here. Keep your shoulders relaxed. And as you exhale, imagine that your body is sinking into the floor. Slowly inhale and come up. Now close your eyes and observe your breath. Doing this posture immediately changes the course of your breath. If you've had a stressful day, a stressful time, the breath becomes very short and shallow, right? And doing a posture like this opens up your breathing channels and pathways and increases the effectiveness of your breath, right? Now, come on all fours. Now, remember your knee is in line with the hip, your hands are in line with your shoulders. Now, inhale, lift hip, chest, and the head up, look up, curling your back, Exhale, round your back and push away from the floor. Inhale. Exhale. Inhale. Exhale.
We now enter another segment called Technovation, our fortnightly segment on IT innovations in healthcare. The topic in this episode is artificial intelligence, a pleasant present to healthcare. Can you briefly explain what actually is artificial intelligence and how is artificial intelligence used for detecting early stage breast cancer in a non-invasive radiation-free manner?
Particularly talking about AI in medical imaging, you would have many of us would have seen these images, and there are also brain, and I think our next speaker is going to talk about the brain and MRI related aspects of it. What I want to sort of focus on is radiology in general, where you use these machines to actually look into the body, because you cannot actually, if you want to know whether somebody has cancer, you cannot actually poke every bit of the skin. Obviously you need to know where is a likely lesion, where is a likely tumor, and then you can do a tissue test at that particular location, right? And so in order to look into the body, we have different types of imaging methodologies, right? And so it could be, MRI, it could be X-ray, it could be ultrasound, it could be an infrared ultrasound, and so on, right? Many methods, PET. So all of these machines you're seeing are, these imaging devices. And use of AI will help in identifying the likely location, right? I mentioned briefly. So this is usually and traditionally done by expert radiologists who are trained to look for abnormalities in images. But what happens when you're looking for early detection? Because early detection is very, very important to save lives. When you do early detection, you're actually screening and imaging almost everyone in a preventive manner. When you're trying to do that, there's huge lot of data or images and tasks, right? Interpretation tasks. The radiologists, becomes a shortage of expert radiologists, because there are only about 18,000 radiologists in the whole of India, for example, right? So this enhanced productivity of the radiologist is very much needed in order to have faster diagnosis, better diagnosis, reduce errors in diagnosis, and overall increasing the patient outcome of detecting, abnormalities early. And as I mentioned, AI really loves pattern recognition. It does very well. And that's why it's a good synergy between the benefit that AI can provide to healthcare and what radiology needs. And then one of the primary areas where AI is used in healthcare is in radiology. And I'm going to talk about briefly, about 5 minutes or 10 minutes, about how AI is used in breast cancer diagnosis. And a quick statistics: it is one of the largest cancer killers in women. 680,000 women died in 2020 because of this disease, and almost 90% of them could have been saved. Yes, it is possible to save lives if we can detect cancer early. Particularly breast cancer is the most manageable of the cancers, of all the cancers, and early detection is very, very important. And if you look at why early detection is not happening, there are several gaps today. Mammography, which is the standard for breast cancer, has some issues, such as there's a concept called dense breast, especially for women under 45 years of age. The X-ray of the breast, which is basically the mammogram is an X-ray. It looks something like this. The whole breast appears white, and how do you find a lesion which is hard stuff, which is a white spot in this? It becomes very, very difficult, and so many women get unnoticed for their breast cancer early. And so they really detect when they're able to feel it as a lump, and that's already stage 3. And how do we enable early stage breast cancer detection? And that is a question that is not yet answered so far, right? And then it's not just women under 45 years of age, even women above 45 have dense breast, almost 50% of them. And even in those cases, mammography is not effective.
Can you explain to our viewers what exactly is functional MRI?
Functional MRI, generally we talk about whenever MRI or any imaging. So we take a structural information which is residing inside the body. For example, if you are taking a structural MRI, it will show you which brain area lies where, just like. Functional MRI is a method when we take the live scanning of the brain, and we can check, like if the person is doing the memory task, so which of the brain area is consuming the oxygen at that time. So functional MRI is a dynamic MRI which gives you the dynamic activations inside the brain related to a particular cognitive or psychological process.
The next segment on Health for All is on brain tumor, diagnosis, and management. A brain tumor is a mass of growth of abnormal cells in your brain. Many different types of brain tumors exist. Some brain tumors are benign or non-cancerous, while some are malignant and or cancerous.
डॉक्टर गुप्ता, हमारे दर्शकों को कुछ ब्रेन ट्यूमर के बेसिक्स के बारे में बताइए। ब्रेन ट्यूमर के सिम्टम्स क्या हैं, क्योंकि ज्यादातर मामले में देखा गया है कि मरीज को जब पता चलता है तब तक काफी देर हो चुकी होती है। तो इसके क्या सिम्टम्स हैं, कैसे वो समझे कि ये ब्रेन ट्यूमर ही है?
आमतौर पे ब्रेन ट्यूमर जो हम मानते हैं वो एक एबनॉर्मल ग्रोथ है जो दिमाग में जो हमारे नॉर्मल सेल्स हैं, जो हमारी नॉर्मल कोशिकाएं हैं और सेल्स हैं, वो अपने आप में अनकंट्रोल बढ़ती जाती हैं, जिनके ऊपर कोई कंट्रोल नहीं रहा। तो इनके सिम्टम्स जो हमारे दिमाग में होते हैं वो मुख्य 3 या 4 हैं, जिनको हमें खास तौर पे ध्यान रखना चाहिए। और इसकी वजह ये है कि हमारा जो मस्तिष्क है, ये जो हमारे स्कल या खोपड़ी है उसके अंदर बंद है। तो ये एक तरीके से अपने एक छोटे से डिब्बे में बंद है। तो इसमें अगर कोई भी चीज बढ़ती या घटती है, उसी के अनुसार हमें उसके सिम्टम्स भी आते हैं। खास तौर पे सुबह उठ के भारी दर्द रहना या नींद खुल जाना दर्द के कारण, उसके साथ साथ उल्टी होना, उल्टी के बाद दर्द में कमी आना, और जो इसके अन्य सिम्टम्स में खास जो है वो है कि मिर्गी के दौरे पड़ना। मिर्गी का दौरा हालांकि ब्रेन के ट्यूमर की वजह से हार्डली 1 to 5% में होता है, पर ये ऐसी चीज है जिसको हम डायग्नोज करके ट्रीट कर सकते हैं। मतलब ये ट्रीटेबल मिर्गी का कारण हो सकता है। इसके साथ साथ आपको हाथ या पैर में कमजोरी आना, क्योंकि ये किसी भाग में, जिस भाग में ये ट्यूमर होता है उसके अनुसार ही हमें इसके लक्षण दिखते हैं। तो अगर ये उस भाग में है जिसमें हाथ या पैर का नियंत्रण है, तो आपको उसकी कमजोरी या फिर उसमें सुन्नपन महसूस होना, या फिर आपको चलने में दिक्कत होना, या आमतौर पे और कुछ नहीं तो सिर्फ चक्कर आना भी एक सिम्टम हो सकता है। तो ये कुछ ऐसे सिम्टम्स हैं जिनको आप नजरअंदाज कर सकते हैं अगर ये कम है या 1 या 2 दिन के लिए है। पर ये अगर लगातार होते रहें और आप इनसे परेशान हैं, तो मेरी यही आपसे सलाह है कि आप तुरंत ही पास के अपने किसी भी नजदीकी डॉक्टर के पास जाइए, उसकी सलाह लें और उसी हिसाब से फिर आगे इसको ट्रीट कराएं, या इमेजिंग करा के जो हमें इसका रिपोर्ट मिलती है उसके हिसाब से हम इसको ट्रीट करें।
What are the typical spinal cord disorders that you see in India?
See, there are plenty of spinal cord disorders that are presently that we commonly encounter in the country. It can range from degenerative. First of all, there's a degenerative pathology. एक हम बोलते हैं degenerative pathology. Degenerative pathology का मतलब क्या होता है कि एज के साथ स्पाइन के अंदर चेंजेस आने शुरू हो जाते हैं, बोन्स वीक हो जाती हैं, डिस्क हर्निएशन हो जाती है, कैनाल स्टेनोसिस होता है, नसों पे प्रेशर आना शुरू होता है, उसको हम बोलते हैं degenerative changes. That is one pathology. Second pathology आती है स्पाइन की ट्यूमर्स की. थर्ड पैथोलॉजी आती है ट्रॉमा की, यानी कि स्पाइन में रीढ़ की हड्डी में चोट लग जाने की. चौथी पैथोलॉजी आती है स्पाइन की जो नसें होती हैं, ब्लड वेसल्स होती हैं, उसका एबनॉर्मल कलेक्शन, एबनॉर्मल बंच, जिसको हम वैस्कुलर मैलफॉर्मेशन बोलते हैं, उसकी. और पांचवी टाइप की कैटेगरी होती है हमारी कंजेनाइटल, यानी कि बाय बर्थ डिफेक्ट्स जो स्पाइनल कॉर्ड में होते हैं. कई बच्चों की स्पाइनल हड्डी स्प्लिट होती है, पीछे से नसें वहां से बाहर निकल रही होती हैं, उसको हम डेवलपमेंटल प्रॉब्लम बोलते हैं. तो ये 5 ब्रॉड कैटेगरीज है स्पाइन प्रॉब्लम्स की, जो हम लोग कॉमनली एनकाउंटर करते हैं ओपीडी के.
कहीं मैंने पढ़ा था कि महिलाओं के केस में सिम्टम्स कुछ अलग तरह के, कुछ एडिशनल भी होते हैं, जैसे एक्सेसिव बॉडी हेयर होता है, लैक ऑफ मेंस्ट्रुएशन होता है. ऐसा क्यों?
देखिए, जो ट्यूमर है वो अपने केमिकल्स रिलीज करता है. दूसरी चीज, ट्यूमर जैसे है वो कौन से पार्ट से आया है, प्राइमरी ब्रेन का ट्यूमर है कि बॉडी के अलग अलग पार्ट्स भी इन्वॉल्व हैं, तो ये सब लेके हार्मोनल इम्बैलेंस कर सकते हैं, जिसकी वजह से भी ये प्रॉब्लम आ सकती है. फिर कौन से हिस्से का ट्यूमर है। एक मेन हमारी ग्रंथि होती है जिसको हम बोलते हैं पिट्यूटरी ग्लैंड, वहां का अगर ट्यूमर है तो वो भी आपके सारे हार्मोनल कंट्रोल पूरा पिट्यूटरी ग्लैंड में बैठा होता है, वहां से भी आपके सारे हार्मोन कंट्रोल आ सकते हैं। तो डेफिनेटली अगर वहां पे है तो वो भी हार्मोनल चेंजेस ला सकता है।
Can you use artificial? See, headaches are of many types. You have migraine, you have this headache, that. Can you use artificial intelligence to grade headaches?
So pain is something that is very difficult to grade because right now we don't have anything that can measure pain. I think so. First thing is when somebody has a headache, what is the intensity, of the headache the person is having? I think based on artificial intelligence, we can put in algorithms. I'll give you an example, right? Like let's take a migraine. Now, if we were to put in algorithms that if somebody has a headache, is it unilateral, bilateral? What type of the headache is it? Is it throbbing? Is it a dull headache? Then based on that, is there nausea present? Do they have vomiting as well? Is there light sensitivity, noise sensitivity present? How long does the headache last? So based on multiple symptoms and clinical features of the headache, we can make algorithms that can probably help identify maybe the type of headache. But there's a lot more than goes into headaches. It was so easy just to identify the type, because when it comes to management of the headache, I think my colleagues will agree, it's such a multidisciplinary approach, because a lot of times there could be an underlying issue as well, like mental health issues, something very simple as anxiety, depression, if we take, or even maybe uncontrolled high blood pressure. At times, those simple things also contribute to the headache. So I think algorithms, artificial intelligence, I always believe, will always be a tool, but can never take off. And I also believe that they cannot be a replacement for the clinical examination and history of a patient. The doctor-patient bond and relationship is so important. And I think that's what people, because what makes me scared for the younger generation, I'll be honest, Dr. Shankar, is that if they are not going to do a clinical exam, if they're not going to do a proper history, which we see sometimes now, that the history taking skills are not as strong as they used to be when we were younger. You cannot, you cannot treat that patient. End of the day, we're dealing with lives. So always we have to use, I think, artificial intelligence will always be a tool, but it can never replace our own thinking power and our evaluation, because it's not generalized medicine. In actual reality, it's always personalized medicine. I think every patient we see, it's a personalized approach.